Welcome to BioanthroStudies. I'm Vanessa Campanache, a bioanthropological researcher. And today I'm going to talk about phosphorus poisoning. More exactly, about Cornelia, a German immigrant in the United States, who was admitted into the Bellevue Hospital on December 17, 1855, with 16 years of age. She had her face swollen and a fistula discharging pus. Cornelia was suffering from phosphorus necrosis of the jaw, commonly known as the Phossy jaw. For 2 years and a half, Cornelia worked in 2 white phosphorus matches factories while packing matches. Match production consisted of heat-dried splints of wood, twice the size of a match. Those splints were then put into a frame and dipped into a mixture that contained white phosphorus. The splints of wood would be removed, cut in the middle, and packaged. The matching process would usually occur in poor ventilated factories. Workers came from the poorest sector of the population, and the employment of women and children ensured low wages. Tasks were gendered, with men and boys dipping and drying the matches, while women and girls would cut and pack. Although a higher quantity of toxic fumes was produced during the dipping stage, women and girls were still at risk of developing phosphorus necrosis of the jaw. They could also get burned while packing due to the easily spontaneous ignition of the matches, which also released toxic fumes. The white phosphorus component in the matches also left the factory walls and workers' hands, breath, and clothes luminescent at night. Phosphorus necrosis of the jaw would be initially confused with a toothache, due to the pain, swollen face, and dull red area that could be in proximity to a deceased tooth. Therefore, as a course of action, the tooth would be removed, but this would not improve the diagnostic, with pain, swelling, pus discharge, and ulcer formation would still be present. The gums would retract from the alveolar surface, which could cause tooth loss. Severe osteomyelitis would emerge with bone necrosis, osteolytic and osteoblastic lesions in involucrum. With time, the necrotic bone could be partially exposed. Therefore, individuals would struggle to eat solid food and could become frail. The spread of the infection could be fatal, as it could lead to septicemia and meningitis. A 20% mortality rate was reported before the emergence of antibiotics. Cornelia was first admitted into the Bellevue Hospital on December 17, 1855, with osteonecrosis on the right side of the mandible extending to the left side, with pus discharge associated with pain and face swelling. The necrotic bone was removed on January 19th without the use of anesthesia. Unfortunately, necrosis continued to extend on the left side with pus discharge. Therefore, Dr. Wood decided to remove the remaining mandible bone. The reconstructed mandible can be seen in the drawing. According to Dr. Wood, Cornelia survived the surgery and maintained all emotions in the jaw area and tongue. You can read more about the treatment in Wood 1857. The reference is below in the description box. According to Wood's report and drawing of Cornelia after surgery, her face contour was mostly preserved, as surgery scars were not visible from a frontal view. However, phosphorus necrosis of the jaw, besides being a debilitating and fatal disease, could cause facial disfigurement, which associated with a foul smell could lead to social stigma. In Wood's text, there is no record of Cornelia's life post-treatment. If you like this video, please subscribe to never miss a video by BioanthroStudies. Your support is very much appreciated.